everyone, my name is Taylor Knapp. This is my informative speech on systemic lupus erythematosus, also known as SLE. The reason I chose to inform you guys of this topic is for two reasons. One, because my best friend Brooke was diagnosed with lupus. Second reason is it is important to learn and be aware about lupus because many individuals don't know what it is. Lack of awareness leads to misdiagnoses, and it is often too late when it is diagnosed. My best friend Brooke was diagnosed with lupus when she was a freshman in college, right around the age of 18. She started having pain in her knuckles that just slowly led to every joint in her body, to the point where she couldn't walk. She was in so much pain. She would crawl around the house, have to pull herself up just to be able to stand. And she hadn't told her parents about what was happening with her body. She had been looking up her signs and symptoms online and had it narrowed down to lupus, but she hadn't told her parents until she went to a wedding reception one weekend and she was in so much pain she just couldn't walk, couldn't do anything at this wedding reception because of the amount of pain she was in. So she finally broke down and she told her parents about what was happening throughout her body. They made her appointment at her doctor's office. They did a blood test that came back positive for lupus, and then she was referred on to a rheumatologist who took all the factors into her life and did narrow it down to what he thought caused lupus, which was the medicine she was on for acne. They immediately took her off of this pill for her acne and put her on prednisone to try to reduce the pain and the signs and symptoms of lupus to try to make her better. After about a year and a half of all of this going on, she finally became somewhat back to her normal self. The prednisone did cause her to gain some weight because that's the side effect of prednisone. So she did end up gaining a little bit of weight, but her life was back to somewhat normal. She was no longer in excruciating pain to the point where she couldn't walk, that she just could crawl. She was finally on the road to recovery. She will never be cured from lupus. She will always have flare-ups, possible flare-ups. Since she's been diagnosed, she hasn't had any flare-ups, so that's good. Today, we'll first look at the pathogenesis of lupus. Second, we'll look at the diagnosis of lupus. And lastly, we'll look at the treatment of lupus. So let's begin by looking at the development of lupus itself. According to Lenman, 2017, lupus is an inflammatory disease that affects the skin, joints, kidneys, nervous system, serous membranes, and any other organ of the body. Between 5,000 and 10,000 children and 2.5 million Americans are affected by SLE in a year. SLE can develop at any age. It is more common to see SLE in children of 5 years of age, and it increases after the age of 16. SIR 2017 Epidemiology of Systemic Lupus Erythematosus says lupus is known as the great imitator. SLE is known as a great imitator because it mimics other diseases such as rheumatoid arthritis. SLE can be acute or subtle over time. Some common symptoms of lupus include arthritis, joint pain, a rash on the cheeks known as the butterfly rash, hair loss, mucous membrane lesions. Any of those things are signs or symptoms of lupus. According to Porth, 2011, Essentials of Pathophysiology, in order to get diagnosed with lupus, you have to meet 4 classification criteria. Those classification criteria, one clinical symptom and one immunological criteria have to be met. Family history is important to review to get where this disease can possibly be coming from. SLE is very difficult to diagnose, as I said before, because it mimics rheumatoid arthritis along with several other diseases that lupus isn't the first thing that comes to mind when diagnosing someone. It causes severe organ manifestations, and pretty much any organ can be involved. Zhang 2016 Effects of Nursing Applied to SLE says that there is no cure for SLE. The ultimate goal in curing SLE is just to have a long-term survival rate, lowest disease activity, prevention of organ damage, minimize the use of toxic drugs, and just improve the quality of life overall. So today we first looked at the pathogenesis of lupus, and second we looked at the diagnosis of lupus, and then third we looked at how to treat those with lupus. Systemic lupus erythematosus, also known as SLE, is an inflammatory disease that affects the joints, kidneys, lungs, skin, any organ that can be found in any adults or any kids. My friend Brooke was lucky enough to have something that actually caused her lupus to make it so the lupus she has isn't as severe as somebody else could have. Hers was maintained by the prednisone, and once she was taken off her acne pill, it reduced her symptoms of lupus, which caused her to go back to having a normal life of being a college student. Thank you for watching.